So the prospective urban-rural epidemiology study, or PURE for short, is a large cohort study of adults from many different countries of all income levels around the world. So far, there are about 200,000 individuals who have been enrolled in PURE, and they've been followed now for about 10 years. And we're able to look at the relationship between what they were like and what their characteristics were 10 years ago and what subsequently happened to them, most notably whether they've died, or if they haven't died, whether they've contracted illnesses, and if so, what type of illnesses.
Some of the kind of key areas we've focused on so far have been understanding the relationship between dietary intake and chronic disease, healthcare utilization and chronic disease, gender differences, air pollution, you name it. If there's an exposure or a health behavior you're wondering, does that cause cancer or heart disease? Likely the PURE study is investigating it.
An important finding from the PURE study is the importance of education as a modifiable risk factor for health. When we looked at all the countries that we studied together, education was the largest risk factor for death and one of the larger risk factors for cardiovascular disease.
One piece of evidence that we've derived that's really informed what I think is the most important thing moving forward was that in many wealthy countries and increasingly in middle-income countries, cancer is actually becoming the leading cause of death. And we expect that if lower-income countries eventually follow the patterns that we see in higher-income countries, we could expect within a generation cancer to be the biggest cause of death worldwide. We need to continue efforts to understand why people get sick, why people die, what constitutes good quality life, and how we can deliver that to people. This is something that I felt very passionate that I wanted to continue on.